Sussex Hospitals is an acute community trust, so we deliver acute services out of 2 acute hospitals, Eastbourne and Conquest at Hastings. And then we also deliver services out of 3 community hospitals.
From a strategic perspective, the trust is now cloud first. So any new requests for new systems will be built in the cloud. We have quite a large on-prem estate that we're also looking at migrating to the cloud.
The key things that we want to do is to get the basics right. So, deliver the foundations, ensuring that we've got the right connectivity, the right devices to be able to deliver, the right access to the clinical systems at the point of care. And then also goes on to actually supporting the patients from a digital point of view. Everything is going online now, so it's ensuring that they've got access to the systems and our healthcare through our digital initiatives, and we're not excluding any of them. We reached out to Microsoft. Microsoft looked at a number of gold partners and effectively set up a presentation with 4 gold partners. And we sat down, had a conversation with those, and that's where we got introduced to ANS. We had no experience in the cloud, so we really needed a partner that could help us take us on that journey, but also support us in that.
The problem we've always had in the past is that we've been limited in what we can deliver by the services we currently have or the services that we can purchase for our on-prem data centers. By moving to the cloud, those limitations are no longer in place. The cloud offers us so much more choice in services and things we can deliver technically.
One of the first outcomes that I can think of is our electronic patient record. We moved that to the cloud, and that has been far more reliable and available since we've done that. So that has an impact on both our patients and our clinicians, that the services are more available and we're not having any downtime or missed appointments.
PLEXUS is a Sussex-wide system as part of the Shared Care Record service, and it's a system that will link up with different clinical systems at different trusts and enables patients to retrieve their own patient information from those systems all in one place.
We looked at a number of options, whether we would buy an off-the-shelf product or whether we would develop it in-house, and we made the decision that we would develop it in-house and do a cloud sort of first approach to that.
That system is being built from the ground up in Azure and utilising Azure native resources, which was a great challenge for us because we had no experience in that field at the time when we started this. So that was where we sought the help of ANS and the Centre of Excellence service to help us deliver that project. The Cloud Centre of Excellence provides skills that we just don't have in-house at the moment. We have delivered a large number of projects that just would not have been possible with the skill set of the staff we have at the moment.
The basic principle of PLEXUS, the Shared Care Record, is to allow clinicians to have access to the patient journey where they interact with other organisations across Sussex. It allows them to make better decisions, having more access to all of the journeys that the patient might be on. The main benefit to the clinicians is having access to that information so they can make better decisions based on the care that they're delivering at the point that they're seeing the patient. I mean, obviously for the patient, they're not having to repeat things and they're getting better outcomes from it.
I can only see the relationship between the Trust and ANS growing in the future. We've already achieved so much. One of my things is collaboration, which is really good. If I propose a new way of working, then ANS are able to sort of work with me on that. And this is the next step really. How do we collaborate more to knowledge share?
One of the challenges that we've got is that we've got a very small team, 2 or 3 people that are working in the cloud environment. They need to be brought up to a decent level of skill set. But we've also got to bring the people that are looking at the on-premise stuff and bring them up on the journey as we move our entire organisation across to the cloud. And we see ANS helping us in that journey.
Moving forwards, we are working with ANS and Cloud COE to transfer those skills in-house.
What made ANS stand out was their professionalism. They made me feel that they understood our problems and knew how we could solve some of them. ANS clearly have got the expertise in all things Azure, whether it be moving servers into the cloud environment or moving data into the cloud environment.
If I could describe our relationship with ANS in 3 words, it would be collaborative, successful and productive.